I'm a consultant general and intestinal surgeon, and I deal a lot with patients with cancer. And what I'd like to talk to you today is the fear and the grief surrounding cancer in general in the public. And the first thing that happens when you announce cancer to a patient is the total fear of death. And also the grief of why they got cancer and what they will have to go through in terms of treatment. And they are very much afraid. And the fear of suffering and death is overwhelming. If we consider, for example, tuberculosis, TB, 100 years ago, if you told someone they had TB, it would probably be the same fear, because there was no treatment. And when the treatment came along in the 1940s and 1950s, suddenly TB was no more a death sentence. And in the same way, if I told a patient that I was going to operate on them for a hernia, or for gallstones, or for their tonsils, they would not be so afraid. They know it's a predictable operation. There may be a bit of pain after surgery, but then they will recover and go on living a normal life. And the problem is, because cancer is associated with uncertainty of cure, and the suffering associated with treatment modalities that will not necessarily cure the patient, conjures up a lot of fear of a lot of suffering with no cure at the end of the day. Hence the fear and the grief. But if I told you that 1 in 2 of us will get cancer in our lifetime, this is where we have reached. This is the disease of our time. This is the illness of the 21st century, just like infections were the problem 100 years ago. 1 in 2 of us will be affected, and globally in the world, half of those getting cancer will be cured. This is where the statistics are coming now. It used to be, for the record, it used to be 1 in 4 about 40 years ago. It came to about 1 in 3 about in the year 2000, and it's quickly coming up to 1 in 2 in the next 5 years or so. This is what I call opening a can of worms. I've tried to understand this myself, and in fact I've presented on it, and it's multifactorial from things like environmental causes, whether it's pollution or the way we eat, the way we live, what goes in our food, what goes into the growing of our food, fertilizers, pesticides, what goes into cattle farming, all the products that are used, the hormones that are used in cattle rearing, and our lifestyle in general. And it is even more interesting because if you look at the patterns of cancer, it is different in a rich country compared to a poor country. Take a Chinese woman and her sister who live in China. Their risk of getting breast cancer is very, very low. You take one sister and you make her emigrate to either Australia or let's say Canada or America. That sister, by the time she's 40, she has the same risk of getting breast cancer as an American or a Canadian. The biggest difference is in their diet. That is the single biggest difference, is what they have been consuming. The patterns of cancer itself are an indirect indicator of economic prosperity. In those countries doing very well economically, you will find cancers of the prostate, breast and colorectal cancers very high, and these will be much lower in poorer performing countries. So Mauritius finds its way coming up towards the richer countries now. Colorectal cancer is the #1 killer in men in Mauritius and amongst the top 3 for women. So really a very high indicator. Breast cancer is amongst the top for women, and prostate cancer is also becoming more common now. So Mauritius is inching towards the more wealthy country. With wealth, you got urbanization, fast food, maybe more obesity, less exercise, more stress, and it goes on like this. It's everything associated with urbanization, or what we call more modern living, actually. The next point I want to make is early cancer detection almost always implies cure. Now, because we know most early cancers will be cured, this is what we need to work on. This is why I want to get the fear and the grief out of cancer, because the fear of cancer gets the patient to delay going to the doctor, because he's thinking, I've got cancer coming, what's the point? They can't do anything for me, I'm going to die, so I don't want to hear the bad news. However, if we could educate them and get them sooner to the doctor and have screening programs in place, we could diagnose it early and achieve a much higher level of cure, hence removing the fear and the grief. And cancer becomes a more common thing to deal with. You live with, you get it, you're treated, and then you go on living. Okay? And this is one of the messages, is to increase awareness, increase screening, increase information, remove the mystery, the idea that it is such a mysterious thing. And I think by reducing the fear, we can actually conquer, or at least get better at conquering this illness. Now, we should also ensure that patients understand that treatment does not have to be painful. There is this notion that cancer treatment is painful. Again, it's hearsay, it's ignorance, and it's fear. Like all treatments can be done without pain. A lot of cancers will involve surgery, more than likely, and to some degree chemotherapy and radiotherapy. In more advanced cancers, we will do chemotherapy and radiotherapy before surgery. In very early cancers, surgery is enough, in many cancers.